Hey everyone, I'm Oliver, a last year Hungarian medical student. I present you an open aorto-birenal bypass performed for bilateral renal artery pathology and a fully occluded SMA in a young hypertensive patient. Our patient is a 41-year-old female who is a pediatrician. She had a history of hypertension since age 11, and it had been managed with amlodipine and olmesartan. She had been asymptomatic and otherwise healthy, with anxiety and GERD, both of which were well controlled. She had undergone a hysterectomy in 2020, during which a CT scan accidentally revealed a vascular abnormality. On physical examination, femoral and DPPT pulses were palpable bilaterally. Blood pressure was well controlled on dual therapy. No bruit or edema were noted. The imaging had revealed a 2.8 times 2 cm left renal artery aneurysm with small progression since 2023, a web-like near occlusion of the right renal artery, and a complete SMA occlusion with well-developed collaterals from the celiac and IMA, and a small 1.4 possible pancreatico-duodenal aneurysm was also noted. Here in this picture, we can have a better view of the renal aneurysm. Because of the young age and multifocal arterial disease, genetic testing had been performed, though it came back negative. Our management options included open surgery, endovascular, and hybrid repair. Given the young age, bilateral renal artery involvement, and aneurysmal disease, the team had decided to proceed with open surgery. SMA bypass had been considered. It was not performed due to good collateralization. Preoperative echo had been normal. We performed midline laparotomy. Then, a 12 times 6 mm bifurcated Dacron graft was sewn in an inverted orientation onto the infrarenal aorta. The left renal artery aneurysm was partially resected and bypassed end-to-end. The right-sided renal artery received an end-to-end graft anastomosis. SMA was patent distally, so no bypass was performed. Left renal ischemia time was 13 minutes, right side 20 minutes. Postoperatively, the patient required 1 unit RBC and got discharged home on postoperative day 7. Pathology had confirmed arterial degeneration consistent with fibromuscular dysplasia. Here in this clip, we can see the 2-month follow-up CT scan, and we can clearly see that the aneurysm is gone, and we can have a look at both of the graft anastomosis. At 2 months follow-up, the patient remained normotensive on half-dose olmesartan with stable renal function and no new complaints. Rheumatologic workup for vasculitis remained negative. The follow-up CT scan was planned for 1 year. In a retrospective research, 40 patients who had undergone open renal artery repair, where aorto-renal bypass was used in 60% of ARES cases and nearly all FMD area cases, early mortality rate was 2.5% and 5-year survival was 88%. Blood pressure had significantly improved in most patients. In conclusion, this case demonstrated the importance of individualized open surgical planning in complex bilateral renal vascular disease. Aorto-birenal bypass had provided excellent technical success, improved blood pressure control, and preserved renal function in this young patient. And thank you for your attention.